welcome back to my A to Z video series on topics to do with pregnancy and perinatal health. My name's Dr. Erin Bow. I'm a clinical and perinatal psychologist and childbirth educator in the Macedon Ranges. Today's topic is K for Know Your Birth Rights. I've been doing this for a while and I've probably talked to hundreds of pregnant women and couples over the last 10 or so years, and it still floors me that people don't know that they actually have rights during childbirth. More to the point, they don't know what they are. They haven't actually considered, in packing their labour bag and choosing a hospital and getting ready for the birth. They haven't actually thought about what their rights are and what their choices are. So I won't go through the whole big list of extensive things. I will put a link below to give you some ideas in case you actually want to know what your rights are. But it's interesting because the American branch of the College of Obstetricians and Gynecologists have recently released a statement, which I suppose comes out as something along the lines of, unless there's an emergency and we actually need to intervene for the safety of mum and baby, back off and leave women alone. Let them do what they want to do, which is amazing considering it's 2017. But I think it's coming off the back of the idea that a lot of us in the birth industry are trying to get across more clearly, is that birth is becoming a bit more like a business. There's KPIs and time management things creeping in and lots and lots of businessy kind of policies which don't really make sense for the process of birth, although birthing is a business and hospitals are there to make money as well as deliver beautiful babies. So I think it's some acknowledgement that along the way a few things have been pushed a bit too much, I think, and we need to just scale back and let labour and childbirth be what it is, a kind of spontaneous natural process that doesn't necessarily need a lot of extra opinions and intervention. So let's talk about some of the things that are within your right to ask for, to request as a birthing woman. Did you know, for example, that you can eat and drink? It's not like the old days where you're refused any fluid or anything to eat, even if you're starving and you've been in labour for hours or even days, because of this fear that you might throw up and choke and all sorts of things will happen. So there's actually no really good evidence that eating and drinking normally during labour has any adverse effects, which also means it's debatable whether you actually really need IV fluids or not. In lots of places it's standard practice, so it's something to think about in terms of where you're labouring and where you live. But this simple thing like you could just have a glass of water rather than having IV fluids. Isn't that amazing? It shouldn't be, but there you go. What else do you want to think about? Things like refusing an internal exam and refusing fetal monitoring or any other sort of monitoring. Again, we're talking about cases where there's no medical emergency and it's not absolutely needed. You don't have to have all sorts of things done to you, poking and prodding, just for the sake of it. And you're well within your right to ask, what would be the benefits of this? What would be the risks of this if I don't do it? What's the evidence base for using this process or this procedure? Something to think about. You can also ask for a second opinion. A lot of us are raised in this, I suppose, framework of thinking doctors are the experts. You do what they say, and if you don't do what they say, you're a difficult patient, or you're trying to make things more complicated for yourself. Not at all. You can, at any stage of your care with your care providers, ask for a second opinion. Ask for somebody different to look at you. It doesn't mean because you chose X midwife or X obstetrician on any particular day that you have to stick with that person throughout the whole pregnancy. There are people who change their mind up until the day before they give birth. If something's not working for you and you're not comfortable and somebody's not listening to you, you can change your mind. It's actually quite simple. What about the idea of waiting and seeing? This idea that before people come running in, guns blazing, saying, we need to do whatever it might be, we need to give you this drug to slow this down or speed this up or get this baby out sooner, you have the option to wait and see. Again, ask, is this a medical emergency? Am I in danger? If not, let's just wait and see what happens. So, before we think about, we have to have a cesarean because your baby's breached, could we wait and see if baby turns around? Are there things that we can do to make babies turn around? Can we choose a different position? Can we just give birth to a breech baby? That's possible. It's been happening a little bit more and more, But these things are not always standard practice. So it's good to ask and good to particularly have your birth partner, whoever that's going to be for you, supporting you on the day or the evening or the long night, who's going to be your brain and to be able to say to other people, what's the benefits of doing this? What's the risk? Like, what happens if we choose something else, ask somebody else? Just opening up that dialogue and thinking, okay, what else is possible? The other thing is you don't have to be told to push. Did you know that? It's something that we see on movies and TV all the time. We expect it's like labour's something that's something done to you, not something that you're an active participant in. So you can push or not push whenever you're ready. Some people like the coaching aspect of being told, right, okay, it's time to push, but you don't have to. It's your right as a birthing woman to do it for yourself, and plenty of women probably find it's something they naturally, spontaneously start doing anyway, and you don't need to be told, all right, now's the time to push. Something to think about. The other thing is this idea of timing. I've mentioned before in my videos, there's no time frame for birth. It shouldn't be time to speed it up now because it's 5 o'clock on a Friday. Birth takes however long it takes, and it's your right as a birthing woman to take your time if that's what you want to do. Similarly, if you do want extra interventions, or you want something, whether it's pain relief, or you want a birth ball, or you want the lights turned out, or whatever it is you would like to have for you, you have the right to ask for that without people rolling their eyes or telling you don't know what you're doing, or saying to you, I've been a midwife for X whatever years, I know better than you do. It's your body, it's your baby, it's your birth. Ask for what you want. Even if you don't know what you want, think of possibilities, suggestions, rather than just being told. Be an active participant in your labour, not a passive one. I think, again, in terms of choosing interventions or choosing even, do you want to be touched or not, that's not something people think about that much. It's like, it's your right whether you are touched or not. Funny. Shouldn't be funny, but it is funny how many women don't realise that they had the option to say, I don't want you to do that. Like, back off and leave me alone. Again, if it's not an emergency, leave me alone, let me do my thing. You also have the ability to make decisions about what happens to the baby afterwards. You know, do you want to do delayed cord clamping? Do you want to refuse vitamin K injections? Do you want to do the hearing test at some other time? Like, you have so many options for what to choose to do. And a good childbirth education course, an independent one like a Hypnobirthing Australia course, can give you the run through of all these things to think about. You don't have to come up with it all on your own. It's just so you're making informed choices. And I guess my personal view as a psychologist and a birth worker is that choice, whatever you want to choose for you, is totally fine. Make sure it's an informed choice. So, if there's anything you want to know more about to do with pregnancy, the postpartum period, or parenting in general, I run hypnobirthing classes in the Macedon Ranges. I also do Skype counselling for people who aren't in the same area as me, and I do mentoring and coaching for birth workers. So, you know, if you're a doula or a photographer or midwife or anybody of that description, perinatal mental health is kind of one of my specialties, and I'd love to teach you more about it. All right, I think that's about all for Know Your Birth Rights. I will talk to you next time. Bye.